Welcome to Dr. Siddharth Roy Homeopathy's YouTube channel, and I'm Dr. Siddharth Roy. Today in this video, how will the COVID pandemic end? We'll talk about it. Don't forget to subscribe to our YouTube channel and click the bell notification so that you don't miss any future video notification. Let's get it started. The pandemic eventually ends, even though Omicron continues to complicate the question of when it will happen. But it won't be like flipping a light switch. The world will have to learn to coexist with a virus that isn't going away. The ultra-infectious Omicron mutant is pushing cases to an all-time high, and an exhausted world struggles as chaos is causing again to stop the spread. But this time we are not starting from scratch. Vaccines provide a strong protection against serious disease, even though they do not always prevent a mild infection. Omicron does not appear to be as deadly as some of the earlier types, and those who survive it will get some fresh protection against other forms of the virus that are still spreading, and perhaps the next mutant will emerge. Dr. Albert Koh, an infectious disease specialist at the Yale School of Public Health, said the latest version is the caveat is what will keep happening until we get really serious about endgame. Surely, COVID will always be with us. We will never be able to eradicate or eliminate COVID, so we have to identify our goals. At some point, the World Health Organization will determine when enough countries have reduced their COVID-19 cases sufficiently, or at least hospitalization and deaths, to officially declare pandemics. Exactly what that limit will be is not clear. Even if this happens, some parts of the world will still struggle, especially for low-income countries that lack adequate vaccines or treatments, while others are more easily transitioning to what scientists call an endemic state. Those are vague distinctions, said Stephen Kessler, an infectious disease specialist at the Harvard T.H. Chan School of Public Health. He defines the endemic period as reaching some kind of acceptable steady state for combating COVID-19. The Omicron crisis shows we are not there yet, but we think we will get to the point where SARS-CoV-2 is endemic, like the flu is endemic. For COVID-19 illness and death, exactly how much of the COVID-19 disease and death the world will bear is largely a social question, not a scientific one. We are not getting to the point where it is 2019 again, said Dr. Amesh Adlaja, a senior scholar at the Johns Hopkins Center for Health Security. We have to make people think about risk tolerance. India offers a glimpse of how it wants to reach a stable level of COVID-19. Dr. T. Jacob John, former head of virology at the Christian Medical College in South India, said that until recently, daily reported cases were less than 10,000 for 6 months. But with the earlier Delta variant, after costing lives, the reason was too painful to calculate. Omicron is now rising again, and India has already started vaccine boosters for frontline workers and people over the age of 50. But like other endemic disease like the flu and measles, outbreaks do happen from time to time, and the coronavirus will persist. Frequent flare-ups, even Omicron has passed. So what's ahead the future? One possible future many experts see: in the post-pandemic period, the virus causes colds for some and more severe illness for others, depending on their overall health, vaccine status, and prior infection. Mutations will persist and eventually booster may be needed, ever so often, that are updated to better match the new variant. But the human immune system will continue to get better at recognizing and fighting back. Ali Albadi, immunologist at Washington University in St. Louis, finds hopes in the body's amazing ability to remember previously seen germs. and create multi-layer defenses. Baseline population immunity has improved enough that even if breakthrough infections inevitably continue, serious illness, hospitalization, and death will decrease regardless of the next type. We are not the same population we were in December of 2019. It is a different land now. We are more prepared with future development of vaccines and antibodies. As we have said in all our previous videos, please wear a mask all the time when going outside. Wash or sanitize your hands frequently. Maintain social distance at all times. Avoid mass gatherings and get yourself vaccinated, as all these steps will help us to end this pandemic. See you all in the next video. Till next time, stay safe, stay healthy. Thank you very much.